Welcome to the Cresco WealthCast. My name is Dimitri. I'm the host of the pod, and I'm also an advisor within the Cresco Wealth Management team. Just want to say a quick thank you to all of you that continue to support and follow the channel. I appreciate you, and of course, welcome back. And if this is your first time to the podcast, thanks for stopping by, and I hope you enjoy. At the Cresco WealthCast, the inspiration was very simple. I wanted to bring topics that were derived from real conversations, and I wanted to do it in a way that was relevant and relatable to you. And a lot of the conversations and the content that you're going to hear, it's coming from clients, it's family, it's friends, it's just being out and about and having those real conversations. Nonetheless, I hope you enjoy, but before I let you go, just want to let you know you can find us on LinkedIn, Facebook, Instagram, and YouTube. Just search at Cresco Wealth Management. Until then, enjoy the pod. Oh, and by the way, that music you're hearing, that's Pete Ems. He's one half of Small Town DJs, and it was nominated for a Juno Award. He's on the team, no big deal. Thank you for joining us again on the Cresco WealthCast. Very happy to announce a couple things today, not only our guest, but the initiative that we have for the Cresco Cares. So for some of you that have already know, or any new listeners, first of all, welcome, thank you. But Cresco Cares is an initiative that we do internally where every year we look to really help in the initiatives that are important to us, important to clients, and really what we think is important that everyone should be aware and raise that awareness for. And this year, it is the Mental Health Initiative for Stress and Trauma, and it is headman by Dr. Matt Hill, who we have in the studio today. I'm calling it a studio, but in our offices. Dr. Matt Hill, Chair of Mental Health Initiative and Stress and Trauma at the University of Calgary, Professor in the Departments of Cell Biology, Anatomy, and Psychiatry at the Hotchkiss Brain Institute at the U of C. Elected as a member in the Royal Society of Canada, College of New Scholars, Artists, and Scientists. Executive Director for the Canadian Consortium for the Investigation of Cannabinoids, and the former President of the International Cannabinoid Research Society, is here to join us today to talk about this initiative. First and foremost, welcome.
Thanks a lot. Thanks for having me.
These are incredible accolades. It's more than I think I'll ever do in my entire lifetime. So number one, congrats. But when I look at this and when I see these items on the list, it's not just about learning something. You're involved for a purpose and a mission to help, to research, to discover, which really leads into the first question so seamlessly. Can you walk us through the origins of the program and what actually inspired you from this standpoint to want to bring this to our attention?
So the Mental Health Initiative in Stress and Trauma, we acronym it as MIST, and so we just kind of always refer to it as the MIST program. It was started actually through a grassroots movement in the community, and so at the end of late 2021, we're still kind of deep in the pandemic. Mike McClay was a loved member of the community in corporate Calgary especially, and he died by suicide towards the end of 2021. And I think in the aftermath of his passing, his friends and family kind of came together and rallied and thought they wanted to create an initiative in his memory to address a very obvious issue that people don't talk about in society, which is kind of the accumulating effects of stress on mental health in relationship to suicidality and major depression, and move this forward on both kind of a research level and also kind of an outreach and education level. And so the initial group that was in Mike's inner circle kind of worked with the Hotchkiss Brain Institute and the University of Calgary to develop this program. And I became the chair of the program a bit over 2 years ago at the beginning of 2023. And with that, when I kind of took this role on, a big part of this was we have two main arms to the MIST program. And the first one is the research side of this. And the main goal of this is to really kind of advance our understanding of treatment options that could be available for major depression, suicidality. Also trying to understand this association between head trauma, like concussion, and the development of mental illness. And that became at the forefront of this because Mike had experienced a concussion in the period leading up to his suicide. And so that was a big thing that became very clear to us, that there was a large gap in knowledge about what the relationship of concussion and the development of mental health issues were, and what the mechanisms were, and could this be treated in a similar manner to how we would try and manage kind of psychiatric mental health issues classically. And so through that program, we are a major funding agency now kind of within the university to support novel clinical trials that are specifically geared at trying to find new approaches to reduce suicidality, to intervene with major depression, and then again to understand these relationships between concussion and mental health. And can we use things like psychedelics, which have become a really big thing for treating major depression in other capacities? Would they have a place here to deal with mental health issues associated with concussion? So that's the kind of research arm of it, and I can go into more depth of that if you're interested. And then the other side of this is obviously the education component. And this is, a lot of this relates to the fact that I think one of the things that's very clear with mental health and mental illness is it's incredibly widespread. And I always kind of say it's the equalizer in society, in the sense that it doesn't matter what your background is. Everyone seems to be afflicted by this. You can't go more than 1 degree of separation with anyone I've ever met and not find someone who has personally been touched by issues related to mental health and mental illness. And so that being said, there is a kind of strange, I think we've made strides in getting over stigma, but it's just not publicly discussed a lot of the time, the same way that we discuss other things like cancer or other illnesses. And so a lot of this is to kind of open the doors and facilitate the movement that's been going on for a few years to kind of destigmatize a lot of mental health issues so that people are more comfortable talking about them, especially men. But also there's an education arm about making people aware about the relationships that exist between stress and the development of mental health, how to recognize symptoms of stress in yourself, how to kind of understand, what is stress doing to my body and my brain? Why is it putting me into a position where I may become more vulnerable to develop various mental health issues? So the kind of research and education are the two main prongs of the MIST program, and so that's the foundation of where we've built everything from.
It seems like a big step as I'm listening to you, going from that research side. We have the group together, we're learning about it, we understand we want that initiative to break through to the next level. How hard was that?
In what sense do you mean by the next level?
In where now you're promoting it, and you've said you've become one of the biggest avenues in this field.
Yes.
And sorry to cut, because I would imagine that it takes a lot. Fundamentally, we can get together and reach, but someone's got to believe in you, or someone has to give you that opportunity to go.
Well, on the side of the execution arm of it, we're really fortunate because at the university here, we actually have a really good group of scientists and researchers in this space. So that was kind of a piece that was necessary, and it wasn't obviously planned in advance because this all happened organically through a grassroots approach. But it was very fortuitous that we just did have clusters of researchers and psychiatry especially who focused on studying suicide, how to intervene to reduce suicide, how to effectively kind of new approaches to trying to treat major depression and things like this. And then on the other side of this, because the community was so behind this, I was really surprised, actually myself, at how much this was embraced. And I think a lot of it is just because everyone has recognized this, but no one quite knows what to do to help push the needle on this in many ways. And so one of the perspectives that we have tried to explain to people is that, one of the main limitations in us moving the needle forward, certainly on the treatment side of this, and trying to understand new approaches that we could use to treat, especially major depression and suicidality, is the way that clinical trials tend to get funded is a long, arduous process. And so it's very drawn out. It's kind of, you have to put in applications through the federal government funding agencies. You go through review panels. This process is not favorable to high-risk studies. This is not favorable to things that are kind of like not something that has been super studied in the past. There's not a wealth of evidence behind, let's say. And so one of the angles we've been able to pursue with the grassroots funding that we've developed here, and we have accumulated, it's been a very successful effort. We're probably at about $5.5 million now, I think, in terms of the fundraising we've had towards this. And all of that money is really being directed right into clinical trials. And the advantage of us doing it this way is that we get to say, studying suicide, for example, is incredibly challenging. And to get funding to study suicidality is virtually impossible because it's a very high-risk study. It's challenging to be able to find outcome measures within suicidal populations where you're tracking someone over time because of the fact that it's a little different than studying like major depression per se, where you kind of have waxing and waning, because typically in the context of suicidality, you would be looking at a high-risk population right after they had expressed suicidal ideation and suicidal intentions, and often they would be in a hospital, and so the question is, how do you recruit people and how do you look at long-term, the changes in that? And so a lot of these are very high-risk studies because of the fact that they don't have necessarily huge outcomes for success because of the fact
that instant gratification. It almost seems the business side to say, hey, if I'm going to put money or fundraising towards it, we have to have a path of results. Whereas because I'm hearing you when you're talking about the suicides and the brain trauma and all of these different things, you're really bringing it all together.
Yeah, and these things take a while to run. I mean, to actually do good long-term studies, each subject will basically have to be tracked for a year. And so these kind of things are very hard to get federal funding behind because you've got to basically explain the case for it. And federal funding is very low risk. They basically just want to fund often things that are almost sure things. And they don't like risky studies like this. And so the reality with it is we can never move the needle on this space unless we take some risks and unless we push things forward in a certain way. And so we go in recognizing there's a chance that the studies may not work, but that's important for us to understand because we need to actually understand how to study suicidality better. We need to understand when can we intervene, what are we looking for? We want to follow someone for a year and we've engaged in an intervention with that person. Do we consider it a success if they have not had any relapse with suicidal ideation within a year span? If there's been no further attempts, is that considered a success? There's just a kind of a lack of strong metrics of what we're looking for here. Whereas if you're studying depression, those are almost like 2-month trials. You look at depression ratings from a psychiatrist and they tend to go down. And so it's a lot more structured the way we would study different things. And then when you roll in something like concussion on top of this, again, this is just like uncharted territory because concussions vary so dramatically from person to person, the intensity that they've occurred at. And so it's a highly heterogeneous population, which again means there's a lot of noise in the system. And again, it's something that requires study and research and intervention, but it's very challenging to engage in those kind of studies when you're leveraging federal funding where they want kind of like very straightforward, very basic studies to be done. And so really I think what we're trying to do with MIST is take the jump into the abyss and just be like, what can we do? What can we try and do to push the needle forward here where we have the opportunity to do something, where we have the funds and the appropriate people to do this, where we can actually start asking questions that are very challenging to put into a clinical framework, but to give us some kind of outcome where maybe we'll see some benefit, because really as of now, there's just not a lot that we've seen in the field that is effective at kind of reducing suicidality. It's a very hard needle to move.
Wow.
And one of the advantages we have is one of the psychiatrists in our group, Dr. Alex McGurr, he's kind of pioneered this new approach where he takes non-invasive brain stimulation using like essentially a magnetic wand, but it's able to really effectively change patterns of brain activity without having to do any kind of brain surgery or anything else. And it had previously been shown by him and others that using this approach can be somewhat effective for depression. But what Alex kind of came up with is this idea that if you use a drug that can boost neuroplasticity, and you give that drug right before you do the brain stimulation, can that make the brain stimulation more effective? And he had a really landmark study that came out about 2 years ago that was right at the heels of the initiation of MIST, which demonstrated that, yes, when he used this drug to boost neuroplasticity right before he did some of the magnetic brain stimulation, he was able to really dramatically reduce depressive symptoms, but most importantly, he was able to bring down suicidality. And so that was a very exciting outcome that he found. And so Alex, we're putting a lot of effort into Alex McGurr's research right now because we're trying to see, are there other drugs that are kind of, FDA, Health Canada approved drugs that are easily accessible, that they themselves may not have a huge effect, but we know that they can boost the way the brain adapts to other interventions and therefore make them more effective. And that's kind of the new wave that we're going with, this idea of dual approaches being combined together that might be more effective than either of them in isolation and might be a new way of kind of approaching treating mental illness.
So, as always use sports analogies. It's really about getting first downs. How are we getting the next first down,
Yeah.
the next first down, and ultimately drive the field? You've touched on some of these already, but to re-ask the question, what do the clinical trials that you're doing right now look like, or the factors involved? Neuroplasticity, as you mentioned, suicide trials, trying to explore that. But what actually goes into all of these studies, or the things that you're working on right now?
Okay, I can outline the three. We've got three main clinical studies that we are funding right now through the MIST program. And the first one is Alex's stuff. So his previous study had been a depression study where suicidality was like an outcome that was kind of secondarily measured. So now the study we're funding with Alex is explicitly a suicide study. And so what he's doing in this context is he's following patients, like I was saying, for a full year in the aftermath of them being released from the hospital after being admitted due to significant suicidal intent and suicidal ideation. And so that is a very high-risk population. And so what the intention is Alex will intervene with them using this kind of non-invasive brain stimulation with a drug that boosts neuroplasticity, and see if he administers this in an intermittent fashion in the aftermath of the release from the hospital, will that help prevent relapse of suicidality? And because, again, it's kind of a one-year track, this will take a bit of time for us to get some data from this, but in the end, this is one of the first studies that's been done that's explicitly targeting suicidality. And it's just, again, like I said, it's a very hard thing to actually study appropriately. So that's...
But to your point, we've recognized it, yourself and MIST and the whole team says, now let's get going.
Yeah. And that's basically...
This is where you come in. Let's get going.
And so this is really... I view what we can do with MIST is fill the gaps that, federal funding has its place, and there's some other things it can do, but there are a lot of gaps that exist. And so we're trying to use MIST to fill those gaps in a way to get the answers as quick as we possibly can. And then another study that we're funding is with Dr. Leah Mayo, and so she was recruited to Calgary about 3 years ago. She's a psychedelic research chair, so she does a lot of human psychopharmacology work, looking at how psychedelics could be leveraged in a clinical therapeutic setting. She's been doing work in the context of like alcohol use disorder and other addiction-related conditions. However, working with one of our concussions physiatrists, Dr. Chantal Dieber, the two of them are now doing a study to look at if using psychedelics in the aftermath of a concussion can help reduce the development of what we kind of broadly refer to as a post-concussion syndrome with mental health outcomes. And so a lot of individuals that have concussion do develop mental health conditions afterwards. And these are kind of somewhat undefined in many ways, but it often clusters around mood disorders like depression. And so given the utility of psychedelics for things like depression and other capacities, this is kind of a novel approach again that is, can psychedelics have efficacy here? And so that's kind of a new exciting thing. And again, because we have... doing psychedelic clinical trials is not an easy thing. And there's really currently, I think, as far as I understand, 2 sites in all of Canada. We're one of them, and then the Centre for Addiction and Mental Health in Toronto is the main other one. And there's a few other sites that are trying to build up, but again, there's a lot of paperwork to go through. And so because we've already got this in place, it allows us to kind of jump into these studies very quickly and effectively and not waste time. And then the third study that we're actually funding is with Dr. Arabachinto, who's a psychiatrist who's also a high-performance athlete. She's on the Canadian Olympic Committee. She was a former rugby player. She's a really amazing person. And she is in conversations again about the relationship of concussion and head trauma and mental health issues. We realize that there's actually like a very sad literature. Like there's just not a lot out there in terms of understanding what actually are the outcomes. And so we've funded a study with her that's really a knowledge gaps filling study where she's studying athletes who have very detailed health histories, especially mental health histories, and then looking at in the aftermath of concussions and head traumas that are almost always occur during sport, like during playing with whatever sport they're playing, but then tracking them in the aftermath to see what is the flavor of the mental health issues that emerge. We believe it's mostly depression and mood disorder related, a phenomenon, but this is somewhat of just a guess based on the phenotypes that people have seen and looking at people, but there's not really ever been a quantitative analysis of this. And so again, this is kind of a knowledge gap study to really understand this better so that we can start directing our resources more appropriately into saying, so what are the main mental health issues that emerge after someone has a head trauma? And does the type of head trauma matter in that capacity? And do they kind of wax and wane, or is this something that gets worse over time? Like, we just do not have this information. And so that's one of the other major things we're trying to fill in.
That's incredible. I mean, it's a lot of work, and you go in and to cheesily tie it into how we operate as wealth advisors, where we say we're the quarterback of the financial picture. You're really bringing that in as well. There's gaps. No one's talking to each other.
Yeah.
Let's bring everyone to the table. And then I like how you say dive into the abyss. 2021, this started. Traction seems to be incredible. Maybe talk through that. What has really brought people together here outside of yourself? Is it recognizing it, you and the team? What brings everyone now? Because I look in 5 years in, call it almost 5 years in, that you've seen great success.
Yeah, I mean, I think a lot of this is just, it's something that everyone can relate to. I mean, I think it just touches a personal element with a lot of people. And, there are, well-established agencies in Canada for people to support, cancer research, MS research, and things like this. But mental health really often falls into a gap itself in so many ways in the health system and in the way that people kind of rally around it. And I think with this, a lot of people in the community recognize this is something that's important, and yet there hasn't really been a clear avenue for them to get behind to support it. And I think as we started doing this, and because, again, I think obviously the grassroots aspect of how this whole program built was very important, because what you had is champions in the community who were well connected and brought other people into the community. And the fact that this was started over someone like Mike McClay, again, who was a very well-liked, very friendly guy who was well-known across many different arms of the downtown sector in Calgary, I think a lot of people could relate to it. And even those that didn't know him seems to be able to relate through their own personal stories. Like, I have to admit, I am leveled often just talking to people at the frequency and consistency of stuff I hear about all the individual stories that people have about what they've gone through, what their children have gone through, what their parents have gone through, what their siblings have gone through. It's kind of omnipresent. It's one of these things that everyone faces. And I think basically what we did with the MIST program was give this a face and give it something for people to get behind. And so it allowed them to rally the resources and say, okay, this is what we want to do. This is what we want to push forward. And I think the other side of it, again, especially in Calgary, like, this is a city of entrepreneurs and people who like to move things forward. And so we kind of also point out, the advantage of our program versus, and again, I don't like necessarily putting things in contrast, but one of the advantages to our program versus kind of a nonprofit organization that does fundraising is we're all employed. Like, we're all employees of the university. All our salaries are paid. The resources are all in existence. So all the money that we fund recruit goes directly into running a clinical trial. We're not using it to pay the salaries of an organization to keep the lights on in a building. And that's just, as much as I'm a huge fan of nonprofit organizations, that is an on-the-ground reality of it, is that a huge amount of the money that gets fundraised for these organizations has to be used to pay the people and the facilities and everything. And so the actual percentage of that money that ends up going into research-based studies is proportionately quite a bit less. And on top of it, typically the way that money, because the people who run the organizations themselves are not the scientists or the clinicians, they have to then outsource the decisions to a grant review panel, which means it ultimately falls back into the same position that you get through federal funding, which is you have to propose an idea for something. And again, these organizations tend to not favor high-risk studies. And so the advantage we have is that we're the ones making the call. We're the on-the-ground scientists and psychiatrists who know the problem firsthand. We understand what the research needs and the gaps are. We don't need to assemble a panel of people. We don't need to pay for rent in a building. So all the money that we recruit goes directly into the trials. And so that makes the turnaround, I think that has actually been a huge appeal, especially to, again, in Calgary, a lot of the people who are in the donor community like the idea that their money is going immediately into clinical research.
Absolutely, because, and it's a fair point and a great point to bring up, is it's a deterrent for those, as you say, in the donor community that want to help out but want to understand that they're actually making that impact. And I think that that's wonderful. And to hear that this is going directly into clinical trials, that it's getting deployed right away for an outcome. Or hope to out. What's the future hold?
I mean, we're ambitious.
Yeah, I like it.
We've got a good group of people. I mean, there's no shortage of questions to ask. I mean, from like Alex McGurr's research perspective, one of the things that we'd really like to start looking at is, again, different drugs that we know can boost neuroplasticity. How are the other ways that we can approach this? Can we use psychedelics, for example, in tandem with brain stimulation? We know psychedelics are a massive way to promote neuroplasticity. That's become very apparent in the last few years. You can cause rewiring in the brain. You can cause formation of new synapses, so brain cells can talk to each other more effectively. And so what would happen if we couple a psychedelic therapeutic treatment with a non-invasive brain stimulation? Well, that dramatically enhance both of those efficacies, because one of the big limitations that we obviously have with the way that we manage depression in society nowadays is you kind of go to your doctor, they'll put you on antidepressant, and it's just a long-term Band-Aid, more or less, to put it. And one of the struggles we've had with managing diseases like this is you're just permanently changing Band-Aids essentially by staying on the drugs. Now, one of the things that appears to have been like the big win with psychedelics is that that's not the way it seems to work. Psychedelic therapy is very intensive. It's single session, sometimes 2 sessions, and that's kind of it. And the efficacy seems to maintain for upwards of a year. So there's some, now we're moving into more long-term studies to kind of understand, do people need kind of an annual reset? And even if that's the case, from a health systems perspective, the burden is dramatically lower. From the individual patient perspective, the burden is much different in terms of how you manage the disease. And so if we can find ways of enhancing the efficacy of these treatments so that people don't have to stay on antidepressants chronically, which comes with a whole host of side effects that often are big deterrents for people to continue using them. So if we can kind of come up with ways to get around that so that there's more effective interventions to produce benefit for people who suffer from mood disorders or suicidality or depression or head trauma, and so that they're not having to stay kind of, changing the Band-Aid all the time. And they have something that gives them more sustained relief for longer periods. That would kind of be my pie in the sky, is how can we do that? And so that's one of our big intentions and one of the things we want to push. The other thing is really focusing on this relationship between head trauma and men's mental health. And so obviously, as I said, Mike had suffered a concussion, and in the aftermath of that had the development of some mental health issues that resulted in his passing. And from talking to we have a very large concussion research group at the university here as well, which is like one of these kind of opportunistic things given the nature of what we're trying to do. And one of the things that they have noticed in a lot of the men that have had suffered from head trauma is there's a big shift in male hormone drops. And so this was just something I had never appreciated, and it's kind of funny given that I have studied hormones and kind of neuroendocrinology for most of my career, but almost all the hormones in our body, even especially as like a guy, our testosterone levels, even though they come from our testicles, it's the brain that controls the release of them. And so there's this tiny kind of teardrop gland that comes out of the base of our skull. It's called the pituitary gland, and it releases all these precursor hormones that tell our testicles to release testosterone or like produce growth hormone and things like this. And so what they have started to understand is that when we get a head trauma and our kind of brain bounces around inside our skull, that little teardrop gland that comes out through the base of the skull, the pituitary, seems to get sheared. There's some shearing damage as the brain bounces around. You can almost imagine if you had an organ like the brain with a small hole in the skull with something coming out, as the brain moves around, it's going to damage that little gland. And as a consequence of that, what they found, Dr. Chantal Dieber has found, is that in about 50% of the men she's looked at that have TBIs, they have massive drops in their testosterone and their growth hormone levels. And as a consequence of that, she has found that by giving them supplemental testosterone replacement therapy and growth hormone, she's seen massive benefits in the mood and depression changes that she's seen emerge. And just something we don't appreciate, because men don't have quote-unquote andropause the way women will go through menopause. And so we know that, as a lot of men will have declines in testosterone as they age, but because it's not a universal thing, it's not been given the appropriate attention. And we've started to really learn that is an important aspect of men's mental health. Is our androgen levels are important, and supplementation of them in the presence of their decline does seem to help a lot of guys. And so the idea that this could be a whole new approach to treating mood disorders associated with head trauma in men, to me, is a fascinating and kind of untouched area. And so Chantal is looking to do a kind of a multi-site trial investigating this, where we screen men after head trauma, measure their testosterone, growth hormone levels. If they're on the lower side, there's someone who seems to have had a drop, then we intervene by giving them androgen treatment and growth hormone treatment and see, can that mitigate a lot of their symptoms and make them feel better again. And by running this through a multi-site center, it actually becomes a legitimate clinical trial that can then be used to inform other clinicians. And so that's kind of the point, is small scale to big scale. So there's a lot of implementation aspects that come into the mix here. And so we'd like to be able to take whatever are the findings we generate here and make sure they get broadcast to the community at large. So people understand there are other avenues, there are other things they can start doing to intervene. And maybe there's some symptoms they should start paying attention to, or biological readouts that they may not have thought were relevant that suddenly they realize become relevant.
Yeah, absolutely. I mean, it brings to the next question, which is great, is, the forward-thinking outlook, long-term. There's some things that are immediate term, but what are some of the challenges that you're facing as well as an organization to make those steps, or areas of opportunity that we can talk about to ensure these steps happen?
I mean, obviously, there's always scalability. I mean, and that's where the kind of fund recruitment comes into play, and the philanthropy is, we want to make sure everyone's aware, like, this is the train is out of the station, like, we're on the tracks, we're moving forward. And despite the fact that we have been very successful with our fund recruitment to date, that does not mean that we're wiping our hands and saying, job done, we're good to go. It's that, no, we want to be ambitious here. The whole point is to make this a large scale thing. Our team at the university has got 7 physicians and scientists that are actively involved in the program outside of myself, that we all work together on this. We strategize what's the next thing we want to hit. The second we hit kind of a financial mark, then that's the next trial we're going to run, and we've kind of got a good balance of where we're at and where we need to go. So, at the end of the day, a lot of it is not the people side. That's all lined up. A lot of it is just keeping the train running as fast as we can. I'm a highly impatient person. I just like to get things done. I don't like twiddling my thumbs with stuff. I've got a lot of irons in the fire with other things, and so I don't want to let things fall off. And so we keep pushing the envelope on this as much as we can to keep the interest and the awareness around it there. This is also why we're doing a lot of outreach in corporate Calgary. Like, we just did a men's mental health event with the city, the Chamber of Commerce of the city at TELUS Spark the other night. We have been doing a lot of intervention talking about stress and mental health with a lot of the different companies around town to make sure people are more aware of this. So there's kind of like two arms of this in terms of the research and the outreach, but they ultimately obviously merge. And so we're trying to keep everyone aware of this and make sure everyone knows what's going on and what we can do.
That's fantastic. And we'll leave it on this one as well, to that point. How do we learn more? How do we get involved? For those listening today, what are the next steps that we can all take to help in this initiative?
So we have a website, which I think we can distribute somewhere. I don't know what offhand exactly. It's the Mist. It's Mist at HBI. Yeah. So the website is really, you can learn a lot about the program on the website. However, to stay up to date, we do have a newsletter through Mist, which is a quarterly newsletter, which we will send out to all of the people who are interested in the program and understanding what the new studies we've funded, what the outcome results are, what things we've got on the program are, what public events we have lined up. So I think that's probably the best way to stay in touch and stay abreast of what is new with the MIST program.
Yeah. And we will have all the links and all of that as well underneath in this podcast. It's on our email signatures as well. And any information, of course, to those websites and those resources, but also here with Cresco Wealth Management, be more than happy to help direct you. I can speak for the team here that it's already been a pleasure to help partner with this initiative from an education standpoint, but hopefully we can conduct and continue to do some great things for this. I can't thank you enough, myself on behalf of the team, for joining us today.
Yeah, thanks.
To help educating us around this topic.
And we appreciate your support. It's great to have groups like you guys behind us and working with us on this, so we're happy to do whatever we can. So thanks a lot.
No, you know what? This could be first of many. Anytime you need the forum here, the microphones are always on. This is something that we could go, and this is what I love, this is something we could go for hours and hours after.
Yeah, easily.
It's so complex and amazing. So I appreciate it here. We got to save you for the Wellington call.
Okay.
Yeah, there we go. Hope you enjoyed the episode, everyone. Thanks for stopping by. Please feel free to leave your comments, or even if you want to let me know topics that you think I should be talking about. You can find us on LinkedIn, Facebook, Instagram, and YouTube. Just search at Cresco Wealth Management. And last but not least, if you want to be up to date with our newsletters, our insights, and even our events that we host throughout the year, you can reach out to me directly. It's pretty simple. You can just go to our website, find me from there, crescowealthmanagement.com. Thanks again, everyone.